Good morning. I'm always so thankful when we are given the chance to tell our personal stories, regardless of whether or not we are believed. Hi, my name is Shelley, and I'm a 53-year-old woman from Timmins, Ontario, Canada. First off, I don't appear to be sick, but the truth is I am. Most people don't believe me when I tell them, or they don't want to believe it. I've been accused of faking being sick, but the truth is, I fake being well. I hide my illness from others for various reasons, which will soon become apparent. Living with an invisible illness, one that is not commonly accepted and for which has no accepted medical label, often leads to judgment and criticism because others believe you look fine on the outside and therefore must be making up your suffering. But just because you can't see it doesn't mean it's not there. You can't see depression, anxiety, or other mental illnesses physically, but that doesn't mean they don't exist. An invisible illness is an umbrella term that for any medical condition that isn't easily visible to others. This includes chronic physical conditions such as arthritis, diabetes, fibromyalgia, and others. Unlike having a condition that is observable, such as a person in a wheelchair or a cancer patient who has lost their hair due to chemo treatments, those with invisible illnesses often face a lack of social awareness and additional stigma, and as a result, these individuals often face more skepticism and are accused of being lazy or moody and in need of cheering up, going out more, calming down, or a host of other dismissive judgments. On September 19th, 2013, I went to my doctor with what appeared to be another urinary tract kidney infection. And because I was allergic to sulfa antibiotics, my doctor prescribed for me a new antibiotic called ciprofloxacin. Well, new to me. He took a urine sample but did not wait to find out whether I had a bacterial infection before handing me a prescription. I remember asking about the prescription, for which he replied, "It's a broad spectrum antibiotic. It will clear up the UTI in just 10 days. It's safe and it's been around for many years." At this time, I had no reason to doubt my doctor. Antibiotics were safe, kind of like taking a cough drop when you didn't really have a cough. When I picked up my prescription at the pharmacy, I received no leaflet of warnings, despite the fact that they had several black box warnings issued by the FDA starting in 2008. Instead, this information was withheld from me. I was not given a chance to make an informed decision to take this antibiotic. They didn't feel it necessary to make sure that I was taking a medication which had disclosed all of the risks. They didn't even tell me about any drug interactions or what not to eat or drink with the antibiotic. Had I known about the stern warnings, black box warnings about tendon damage, serious neurological damage, etc., had I known that some of the side effects may be permanent, I would have insisted on a different and safer antibiotic. I was sort of lucky, that is, luckier than most other people who have been seriously disabled from severe adverse drug reactions to this class of antibiotic. I say lucky because unlike many others who fail to connect the dots of their sudden symptoms back to their antibiotic, I experienced an anaphylactic reaction to my ciprofloxacin just 5 pills or 2.5 days into my 10-day run of 500 milligram prescription. Swollen lips, tongue, difficulty breathing, racing heartbeat, severe anxiety, headache, dizziness, nausea, joint pain in my left hip and shoulder, numb and cold arms, but an itchy rash with a sensation of burning skin, and of course, lots of anxiety. I told the doctor that I felt like I had been dipped in a vat of peppermint, that my skin was on fire, and I was scared to death. However, they ran all kinds of tests that didn't prove that I was in the kind of distress that my body was telling me that I was in. I was sure this was an adverse reaction and not just a simple allergy. So I felt like a fool. I looked like a person who was suffering from anxiety and having a panic attack, that I was a waste on the ER's valuable resources. I felt that I wasn't believed, and I was dismissed for lack of empirical evidence that had failed to prove an adverse reaction. The ER doctor informed me that I didn't have a UTI or kidney infection and should not have been taking any antibiotic. But because I was now experiencing an allergy to this one, he would take me off of it. He would note my allergy in my medical records. He assured me that once the drug was out of my system, I would soon feel much better. Essentially, he treated this like he would any other allergic reaction. He gave me Benadryl, Gravol, and an IV NSAID, Toradol, for the pain. The ER doctor also insultingly asked me if I was seeing a psychiatrist. And when I said no, he then suggested I return to my family doctor and inquire about antidepressants for my anxiety. I knew instinctively that this was no ordinary allergic reaction, and that my anxiety was coming from my deep-seated fear that my body was in crisis. I was listening to my body. But to give a patient NSAIDs, steroids, or even fluoridated drinking water after an adverse reaction to a fluoroquinolone is probably the worst thing you can do. Perhaps patients would be better helped by administering magnesium and NAC. Unfortunately, I did not feel better in a few days. My skin became very dry. I seemed to visibly age overnight. I was getting up several times during the night to urinate, sometimes passing out in the bathroom floor. I had terrible left flank pain. I was excessively thirsty. My mouth was dry. My tongue actually was stuck to the roof of my mouth in the morning. It was that dry. My body was inflamed. My eyelids, face, and fingers were swollen every morning. I literally looked like I had been poisoned. I was having panic attacks where before I took this drug, I had never had one. I was experiencing insomnia, and I was exhausted, very low in energy. Yet when I did sleep, I was having vivid nightmares. My eyesight was blurry. My ears were congested. I was having difficulty hearing, ringing in my ears, and sinus issues. I couldn't bear to have anyone touch my ears. Even pulling sweaters over my head, which I now needed help to do, hurt my ears. I was having mobility issues, walking with a cane, difficulty climbing stairs. I had tight neck muscles. My collarbones ached, and my head felt too heavy to hold it up. I was suddenly weak. My hands and wrists couldn't support a mug of hot coffee, or open jars, or pull up my own blankets once in bed. I was dizzy, unbalanced, experiencing vertigo, and I was confused. My brain was in a fog. I was having vocabulary recall problems when trying to communicate, and it sometimes hurt to talk as my throat hurt. My voice was hoarse, almost like I had been yelling for hours. I couldn't sing anymore. I was choking on my own saliva. I was suddenly having food sensitivities to food I wasn't sensitive to before, with hives and rashes. I was bloated with gas, cramping, and diarrhea. I had vagus nerve damage. I could no longer gag. My arms and legs felt numb and tingled like a feeling of bugs crawling up them or water dripping down them. My arms often fell asleep, and this was not because I was cutting off their circulation, and not only while sleeping, but during the day while holding a fork or a pen or typing. My hands and feet were always cold. I couldn't monitor my body temperature and would seesaw back and forth between being too hot or too cold. I would have excessive armpit sweating, hot flashes, and night body sweats. My lymph nodes were swollen, especially under my armpits, and my breasts were sore. My own sweat and urine smelled offensive to me. Many a night I could smell smoke and thought the house was on fire, which would of course trigger a panic attack. I had dysautonomia. It has to do with the nervous system being all on and touchy at times, where lots of senses are on high alert and shouldn't be, or at least had no good reason to be. If someone came in the room and I didn't hear or detect them, or even if they came suddenly behind me when outside walking the dog, during those times, they would startle me so much that I physically jumped and yelled out. I would end up scaring the other person who could not understand how I had failed to hear them coming. This is not a normal reaction. Dysautonomia is best described as a physiological response or overstimulus of the autonomic nervous system. This is why my bladder, intestines, and my sweat glands, pupils, and blood vessels were all affected. I was zapping myself and husband with minor static electricity charges when I would touch him, or a light switch, or the handle on our truck. I was experiencing muscle twitching and jerking and lots of hiccups. Myoclonus is a brief involuntary twitching of a muscle or a group of muscles. It describes a medical sign and generally not a diagnosis of a disease. These myoclonic twitches, jerks, or seizures are usually caused by sudden muscle contractions, positive myoclonus, or brief lapses of contraction, negative myoclonus. The most common circumstances under which they occur is while falling asleep. They're called hypnic jerks. Myoclonic jerks occur in healthy persons and are experienced occasionally by everyone. However, when they appear with more persistence and become more widespread, they can be a sign of various neurological disorders. Hiccups are a kind of myoclonic jerk, specifically affecting the diaphragm. I had both, with no pattern, the jerks often waking me up and hiccups that would last for an hour. By Christmas of that year, just 3 months after taking ciprofloxacin, I was thrown into instant menopause. I was losing my hair and it came out in clumps on my pillow every morning. I could no longer walk without a cane. I had a painful frozen shoulder or tendinitis, painful left hip joint, arthritic in nature, muscle fatigue, cramping and twitching, sciatica pain, and ischial tuberosity pain, also known as sitting bone pain. That pain you feel when you've been sitting too long, maybe irritation or inflammation of the ischial bursa, a fluid-filled sac located between the ischial tuberosity and the tendons that connect the hamstring muscle to the bone. So essentially, I was having some of the tendinitis and tendon weakness problems that one of the 4 black box warnings had been issued against this drug. I was also having extreme mobility problems, walking, wiping myself on the toilet. I could no longer sit cross-legged on the floor or bend to pick up something dropped on the floor. I could no longer wear high heels or have sex with my husband because I couldn't maintain a comfortable sexual position. My husband had to cover me with blankets at night. He had to help me to get into a sitting position in bed. He had to shampoo my hair in the shower as I couldn't lift my shoulders. I fell down our stairs, breaking 3 fingers on my left hand. Shortly after that, I developed what is called a trigger finger, and my broken fingers never healed properly. I am not able to make a tight fist with my left hand. I suddenly needed assistance to climb or descend stairs. I was waking my husband up with panic attacks, and after he cared for my needs, he would have to head off to work exhausted. I was basically an invalid in need of constant round-the-clock care. I began feeling guilty that I needed my husband's help, especially when I witnessed what this additional stress was doing to him. I did return to my family doctor. I was careful to hide my anxiety. Why? Because women in pain are more likely than men to receive prescriptions for sedatives rather than pain medication for their ailments. I wanted a doctor to listen to me, empathize, and work with me to identify the source of my medical problems. He was more likely to dismiss my main complaints to focus on my anxiety. What I absolutely did not want was to be patted on the head and sent home with a prescription for Prozac. So I forced myself to remain calm and to not let my fear take over, especially in front of my doctor. He did one of those knee hammer tests for my reflexes, and when my knee didn't immediately respond after being hit by the tiny rubber tomahawk, he looked scared but said nothing. I had no idea at the time of this test that the absence or decrease of this reflex during my knee hammer exam was problematic. It wasn't until later, when I Googled about it, that I learned that he was running a central and peripheral nervous system test on me. After he confirmed that I had a decrease in this reflex, he had me stand and squeeze his hand and announced that I had carpal tunnel syndrome. I almost laughed aloud at his idiotic diagnosis. What I was experiencing went way beyond carpal tunnel syndrome. He also told me that I should go and seek physiotherapy for my sciatic issue, but of course this isn't covered by OHIP, and we couldn't afford for me to go. I had come to my doctor to report a very serious adverse drug reaction to ciprofloxacin, and I was dismissed, despite hiding my anxiety. My main complaint had been chronic pain, sore joints, especially my left hip and shoulders, and mobility issues, and yet he ignored these to focus on my wrists. Did he know that it was an adverse drug reaction? Was he afraid to admit it? He did not explain to me that I likely had peripheral neuropathy, nerve damage, and that it was caused by this drug. I doubt that he even reported the drug reaction to Health Canada, as I fear he didn't want to take responsibility for giving me this prescription. His office never called me for a follow-up appointment. It was as if he wanted to forget that I was his patient, and I certainly had no desire to return to the scene of the crime. Before my doctor prescribed Cipro, he was aware of my full medical history. He knew that I had been a premature infant born 8 weeks early with immature kidneys. My kidneys never did function at full capacity. I had exploratory surgery at age 2, and from age 2 to age 6, I had to take a yellow liquid medicine for my kidneys, so tells my mother. He also knew that I had IBS and celiac, and was aware of past surgeries to remove my gallbladder, my appendix, and cysts on my ovaries. He also knew about my endometriosis and SIBO. That's a short form for small intestinal bacterial overgrowth. He knew how long it took my liver to process and detox drugs because I had related the story of taking Dramamine on my honeymoon and sleeping for 4 days. He didn't even wait to see what kind of bacteria I had to assign the right antibiotic for the job. The antibiotic best to kill the bacteria that was making me sick. And as it turns out, I didn't even have an infection. The very first black box warning in 2008 stated that in patients with reduced renal function, the half-life of ciprofloxacin is slightly prolonged, and that at the very least, dosage adjustments may be required. Yet I was prescribed 500 milligrams of ciprofloxacin and not the 250 milligram dose adjustment amount. I later learned that adults with impaired renal function, ciprofloxacin is eliminated primarily by renal excretion. However, the drug is also metabolized and partially cleared through the biliary system of the liver. Mine was sluggish at best. And through the intestine. I suffered from IBS, sometimes diarrhea, but alternated between both diarrhea and constipation. NSAIDs always cause constipation with me, and I was taking my ciprofloxacin with Tylenol. According to the black box warning, these alternative pathways of drug elimination appear to compensate for the reduced renal excretion in patients with renal impairment. Nonetheless, some modification of dosage is recommended, particularly for patients with severe renal function. At the very least, this precaution should have been made for me. I should have been prescribed no more dosage than 250 milligrams every 12 to 18 hours. But because my other pathways of detoxification were also impaired, another antibiotic should have been given to me. This is clear negligence on his part, and my doctor is fortunate that I didn't decide to pursue justice. Many patients who suffer from adverse symptoms mistakenly assume that the drug is trapped inside the body, causing continual damage. It is not. It has exited the body. It's not that the drug stays in the body and never exits. It's the speed at which it exits the body that causes the damage. It was moving through my body at a snail's pace. So therefore, it has more time to cause damage. Let me paint a mental picture here of what I was physically like before ciprofloxacin destroyed my health. I was formerly a youthful and very active person. When my great-grandmother was still living, everyone thought she was my grandmother. They thought that her daughter, my real grandmother, was actually my mother, and of course my mother had to be my older sister. My youthful looks were inherited from my maternal line. I was very active. I could mountain bike for miles, jog and run, walk and dance, jump and twist. I could exercise. I could skate and do figure eights on the ice. I could lift heavy loads, including lifting the equivalent of my own body weight, and also push things with my arms or legs. I was like an Energizer bunny. I had loads of energy. I was almost unstoppable, and few people could keep up with me even at age 47. I was also very flexible. I could do men's push-ups repeatedly. I could kayak and fish. I went on zip lines. I took risks. I wasn't afraid to try new things. I had 2 tattoos and rode a motorcycle as a passenger with my husband all over Ontario. We used to go camping into remote areas of Canada. I have fed wild caribou on the Slate Islands and lunched with eagles sitting in the trees. And now, suddenly, overnight, this all changed for me. My health was turned completely upside down immediately after taking ciprofloxacin. I could no longer do any of these activities that I had once enjoyed. Can you imagine what would happen if I had been a gold medal Olympic athlete when I took ciprofloxacin? My career would be over. Some days, when my husband was at work and I was home alone, I would study myself in the mirror, and I didn't feel like me anymore. I felt disconnected somehow, as though I was observing myself from outside my own body. I felt like I was in a dark tunnel. Who was this sick, elderly person? I didn't even know this woman or recognize this woman. What I was experiencing is called depersonalization and also derealization. I had difficulty feeling intense emotions like I once did. I used to be accused of being too intense due to my wide range of emotions, but now I was somehow flatlined and felt emotionally numb. I had brain fog. My brain felt like I had cotton stuffed in it. I couldn't keep my focus on what I was doing or follow a conversation. And whenever I asked my husband for his opinion as to what he thought was happening to me, he said, I don't know, maybe it's menopause. It seemed logical, but I was only 47 years old. I was still getting my periods on time every 28 days, and I still had a very active sex life with my husband. I thought menopause was more of a gradual process, not something that came on suddenly and with such ferocity. And also, menopause did not come with the array of symptoms that I was experiencing. I was even hoping that I might have another child, as I was very healthy and youthful, 47-year-old woman, but alas, this was not to be. At other times, I would blurt out incorrect statements, like the time I was washing the dishes and I told my husband that the laundry would soon be done. The look on his face said it all. And I would start to cry because I thought I was showing signs of dementia or early onset Alzheimer's disease. Another time, I put bleach in with our dark load and ruined a load of laundry. I was a very capable person once. I had a very large vocabulary, was an excellent speller and reader. I had a high level of reading comprehension and excellent communication skills, as well as excellent listening skills. My memory was so good that I could recall small details and dates that others could not. I had confidence in my own abilities, and I was a perfectionist. But now I was putting bleach in dark loads of laundry. My self-confidence took a nosedive, and I had to abandon my perfectionism to settle for what I was able to do now. My housework suffered, and I needed to take several naps during the day. I changed. One of the scariest moments was one afternoon I fell asleep on the sofa. I remember that I was on my back. My feet and legs were over my husband's legs. I was snuggled under a thick crochet blanket. When I awoke, I was overheated, but I couldn't get my arms to respond in order to push off my blanket. I couldn't move my legs to alert my husband that I was too hot. And then I couldn't open my eyes or speak. I was intensely afraid and panicked, which then made it difficult to breathe. I felt that I was suffocating. I could hear the TV and my husband sniff and felt him shift his weight, but he couldn't hear me. I was trapped in a place that was frightening to me. My husband could not hear that I desperately needed his help, even though I screamed out for help. Maybe I had a stroke. This terrifying episode lasted for what seemed like a long time, but was probably only a few minutes before I could finally open my eyes and move my arms. I was very emotional when I could finally tell my husband what had happened. He was very supportive, told me that I had only been sleeping for about 20 to 30 minutes, but to me, it felt much longer, more like several hours. Unable to shake the terrifying memory of what happened to me, I later Googled what I had experienced and discovered sleep paralysis. It is when you wake up and can't move. That's it in a nutshell, I said. Apparently, it occurs when part of the brain is awake, but the parts controlling your body are still asleep. And when you try to move during sleep paralysis, you are unable to for several seconds or even for a few frightening minutes. When I read that this can happen as a result of specific genetic changes triggered by sleep deprivation, physiological stress, or abnormal sleep cycles, or from perhaps anxiety, I began to worry even more. Was my adverse reaction to ciprofloxacin causing genetic changes? Further, I read that people who take certain medications can be more likely to experience sleep paralysis. Prescription medications and recreational drugs can actually increase the risk of sleep paralysis. I Googled drug-induced sleep paralysis and found this on medlink.com. Sleep may be disturbed as a sequel of other drug-induced adverse drug reactions. For example, patients with movement disorders may have difficulty sleeping, and patients on diuretics may have to get up frequently at night to urinate. This article describes sleep disorders associated with the use of therapeutic drugs. The information is based on a review of the literature and on reports of adverse reactions received by pharmaceutical manufacturers. The causal relationship is not proven by the usual scientific criteria, but the list of drugs should be considered during investigation of patients with sleep disorders. The International Classification of Sleep Disorders, ICSD-3, mentions, quote, sleep disorders resulting from a drug or substance, end quote. So under 5 categories, but it was the 5th category that interests me the most, where it mentions sleep-related movement disorders. This is from the American Academy of Sleep Medicine from 2014. Drug or substance can be a prescription medication, recreational drug, caffeine, alcohol, or food item, or exposure to an environmental toxin. Drug-induced sleep-related movement disorders such as excessive movements of limbs, restless leg syndrome, or myoclonus. Bingo! I've suffered from RLS for years, since puberty. It was only mild, quite controllable, but since taking the ciprofloxacin, which is a prescription medication, my RLS episodes have become more frequent and last longer than ever before, which keep me awake. And further, I was now experiencing myoclonus jerking in my legs and also hiccups. No matter the cause of the sleep paralysis, and I know that mine was not caused by caffeine, alcohol, or recreational drugs, I did not want a repeat episode. I knew I needed to sleep better, at least 6 hours or possibly 8 hours of uninterrupted sleep per night, as I know that healing is greatly improved with sleep. But now I was actually afraid to fall asleep in case I experienced another episode of sleep paralysis, which thankfully did not happen again, but for months after I suffered from insomnia or the ability to stay asleep for longer than 5 hours per night and was often awake with either my RLS and or my myoclonus jerking. I also had debilitating headaches and migraines that started about mid-February 2014. I had a migraine for 2 weeks solid that sent me to the eye doctor for answers. I received a prescription for new eyeglasses for changes in my vision and was diagnosed with migraines. As the years ticked by, fast forward to 2018, my eye problems have multiplied. My eyes are dry and itchy. I cannot wear makeup. Well, I couldn't wear makeup leading up to 2018, but it's a little bit better now. If I only put it on occasionally, it doesn't seem to bother me. But if I use eyeliner underneath, it irritates this biofilm, and I'll describe that in a second. My eyes were dry and itchy. I couldn't wear makeup anymore. I woke up with swollen eyelids every morning and sometimes stabbing pain. They became light sensitive. I had blurry vision, and there was a biofilm that seemed to be inflammatory triggered that would creep up and block half of my vision, but would go away when I reduced the inflammation. So this was not the same as cataracts. There are warnings that fluoroquinolone antibiotics can cause photosensitivity. I certainly have photosensitivity and must wear dark glasses when I am outside, regardless of whether the sun is bright or overcast. I have been diagnosed with Mobius gland dysfunction. MGD is a common eye condition where the eyelid glands that secrete oil get blocked with thick secretions. This is the biofilm that I described above. For my dry eyes, I have to make use of a special lubricated eye drop formula. According to my eye doctor, I have narrowed angle drainage, allowing a buildup of fluid. There is fluid trapped behind my eyes, which the optometrist would like to drain with a laser treatment. But because of my adverse reaction to ciprofloxacin, I cannot complicate my health situation by using steroids, and my doctor will not do the procedure without using steroids. He did tell me that the laser surgery is risky and may cause scar tissue resulting in auras or spots and making my eyesight problems worse and not better. He cannot do the final test to check for glaucoma without draining this fluid and lowering the pressures, allowing him to see into my eyes with a special mirrored gadget and use dilating drops. Besides, all eye surgery needs an antibiotic. And guess which antibiotic is the favored choice? You guessed it, fluoroquinolone eye drops. And there's a whole list of the ones that they can use. My eye pressures are 16 in my right eye and 18 in my left eye. Anything measured 20 or above is cause for alarm and could indicate glaucoma. I have been instructed to return every 6 months to check my pressures, but OHIP doesn't cover eye care. There are things that I can do to manage the MGD. I'm increasing my omega-3 fats from 1 teaspoon to 2 teaspoons daily, which I cannot always afford to buy fish oils. This has the added advantage of helping my arthritic joints as well. I was only taking 400 IU of vitamin E, but we'll have to increase that to 1500 IU, which is the upper range. I also should increase my B12 to 2000 mcg, at least on a temporary basis. Other things to try to include lid scrubs, using lid scrub towelettes or baby shampoo applied to eyelid with a cotton swab or clean fingertip, hot compresses for 5 to 10 minutes daily, using lubricated eye gel formulas for my dry eyes, which I do, drinking plenty of non-fluoridated drinking water at room temperature, protecting my eyes from the wind, using a humidifier in my bedroom, and finally taking eye care supplements that include lutein and bilberry. But the most disturbing of all the eye problems was his declaration that I had retinal dysfunction and permanent optic nerve damage, and that I will eventually be blind. That I would have start start having increasingly more optic migraines before I lost my eyesight. And if the pressures in my eyes build to 20 plus, I would likely have intense pain that will send me to the ER. A simple visual screening test called Functional Acuity Contrast Test, also known as FACT, is a well-established analysis used by ophthalmologists. The patient is asked to look at a series of grayish lines of decreasing clarity. If the patient is unable to see the lighter lines that normal people can, this indicates poor retinal function and has been closely linked to biotoxicity. I could not see the lighter lines during the FACT test. What does mold, which is a biotoxin, share with fluoroquinoline toxicity? Fluoroquinoline toxicity is a synthetic toxin. Dr. Richie C. Schumacher, author of Mold Warriors, has discovered a whole series of biochemical tests that show the patient is experiencing an inflammatory reaction to toxin. And this toxin could be a biotoxin, such as mold, or it could be a synthetic toxin, such as from a fluoroquinolone, which has been cooked up in a lab. The combination of quinolone and fluorine, which is a derivative of fluoride but not the same as, that was later added to the antibiotics as a potent delivery system, has created, in my opinion, a lethal drug that seriously damages the human body. But because no test can prove this toxicity, no doctors recognize this synthetic toxin as a threat. Perhaps we should take a better look at the FACT test as possible evidence for those who are experiencing an inflammatory response to a synthetic toxin. Mold is not easily diagnosed either, and without a clear awareness of mold toxicity, doctors treat patients with antidepressants and other medications that might take the edge off their symptoms, but unfortunately cannot provide the definitive help these patients so desperately need. Fluoroquinoline toxicity is every bit as hard to diagnose as mold toxicity, and patients are just as desperately needing proper diagnosis. Our medical community has difficulty embracing new concepts, and this is a perfect illustration of how the reluctance to accept new ideas can hinder a patient's ability to obtain correct diagnosis or treatment, which currently doesn't exist for fluoroquinoline toxicity. But some doctors know how to treat patients for mold toxicity. Some people suffering from fluoroquinoline toxicity have worked out that many of us might have something in common, and that is an MTHFR gene mutation. That essentially means that our detox pathways don't work properly. It is estimated that only 25% of patients are genetically unable to make the antibodies they need to detox these toxins, which would seem to vindicate pharmaceutical companies that claim adverse reactions are rare, except for one thing. Many others do not have a gene mutation, and yet were also injured or damaged by a quinolone or fluoroquinolone antibiotic. I, however, as previously stated, do not detox well. Many medications stay in my system overly long, and for this reason, I cannot take cold medications or any drug that causes a sedative effect. I am also allergic to NSAIDs, morphine and codeine, as well as sulfa medications used for urinary tract infections, which is why I ended up with ciprofloxacin. Many a time in early 2014 did I fear that I would end up in a wheelchair. I was worried about being a burden on my husband and son. I worried that I was going to end up in long-term hospital care, or worse, that I would die. I was also worried about the financial burden that this would place on my husband. And some days, I thought that suicide might be a relief. Unfortunately, I never attempted the worst case scenario. I have a strong Christian faith in Jesus and had a loving family that would never recover from my suicide. Fortunately, I held on to what hope I could, and in the summer of 2016, I saw much improvements in regards to my health that are the result of my own care with no help from doctors. But I wonder how many people can understand how difficult it is to do research, to understand medical jargon without schooling, and to do this while sick, in pain, and exhausted. In my library profession, I am neither a doctor nor medical researcher. Yet in a sense, I was forced to become both in a quest to regain my health. All I wanted was for one doctor to believe me and to help me, but none would. Yes, I am greatly improved, but still I grieve for my previous happy, active, and pain-free life. I still have ongoing medical issues that require the help of a medical doctor, and I still have financial difficulties because my disability is not recognized by Health Canada. These have not been easy years for us. We lost our beautiful house in Kitchener because of our combined health problems. We had to declare bankruptcy. We were homeless Christmas 2015, and a friend took us in until the spring of 2016. The stress of losing everything was incredibly difficult. We had to sell many of our treasured belongings and find a new home for our dog Rizzo. We were forced to move to a smaller, less expensive city, far from my family and friends, so we have no support in our new home. Now we live in a small northern Ontario city. We rent a 2-bedroom apartment in a less than desirable area. My husband is working again and we are making our bills, but we have a very tight budget. It's hard to afford the things I need, like healthy food and supplements. Sometimes I only eat one meal a day to save on money for supplements. Unfortunately, I am unable to hold down a job, even one that is part-time, due to my PTSD. I'm currently seeing a therapist who is helping me to work on strategies to combat or reduce my anxiety. I have a deep mistrust for pharmaceutical drugs and medical doctors. I detest going to the hospital. I'm very much into natural herbs and medicines now, and I do not take any synthetic medications for fear of them causing more damage, not even Tylenol. I prefer to use warm spices, herbs that reduce inflammation. I deal with chronic pain by taking Boswellia, which is an Indian form of frankincense. I only see a medical doctor now when I absolutely have no choice but to do so, and then it's only for tests. Written prescriptions usually end up in the waste bin, as I rarely get them filled. It's risky going to a hospital for 2 reasons. Getting sick while sitting in the waiting room with people suffering from colds or flu, and having to advocate against being given medical drugs while trying to obtain a diagnosis. It is exhausting going over my allergy list only to be ignored or more, laughed at. Sometime between 2016 and 2017, I had to visit our Timmins Hospital for the first time. I was appalled at the unsanitary state of this hospital. But I had abdominal pain, I wasn't sure what the source was, and I needed to wait to be seen. This was the last time that I received the NSAID Toradol. I had informed the intake nurse of my allergies to painkillers, and so I wasn't expecting to be given anything. A nurse came and gave me a shot of Toradol in my leg without checking with me. I tried to refuse it, and she insisted and jabbed me extra hard in protest. The injection crippled my leg. They then left me naked on an exam cot that had the bottom half removed for a female exam. Here I was, balancing on a cold exam cot, shivering like a leaf, crying, and in horrendous pain from intense muscle spasms emanating from the insert wound. And I had to pee. I called out for assistance. I wasn't sure that I could walk. No one came. I somehow managed to get off the cot and dragged my non-functioning leg to the bathroom to relieve myself. When I came out, there was no one around. Some of the lights had been turned off. I could hear one woman vomiting in her curtained stall. The rest of the patients were sleeping. There were no nurses to ask for a warm blanket, so I returned to my exam room still shivering. My nails were blue and I was shocky. My leg was still in spasm and the Toradol had not taken away my pain from my abdomen. I waited for my ultrasound. Finally, they took me down. It was around 1:30 in the morning and I had kidney stones. When I was finally released, I hobbled out of the ER with my non-functioning leg and swore never to return even if I was dying. It was one of the worst ER experiences of my life, besides the time they made me wait 11 hours for a D&C after I lost my first baby with no food. That was in the Kitchener Hospital. That one wasn't in the Timmins one. But of course, I have had to return. Each time my voice gets stronger, but the bad experiences continue. Once I was handed a urine sample that didn't belong to me. Another time I was placed in a waiting stall where someone had vomited and it wasn't cleaned up prior to me being sent in there. Other times I've had tests disappear and have had to repeat them. Is there any wonder why I hate hospitals? The waiting times to see a doctor are too long, and then when you do see a doctor, he is so busy he doesn't have time to answer questions. My cousin's wife was sent home from a hospital only to have a massive heart attack and died. She left a husband with 6 children to raise on his own. Our medical system is a sick joke. Since the sleep paralysis can happen as a result of a prescription drug, I wondered if anyone else might have had the same reactions from their antibiotic. When I went searching online, what I discovered about ciprofloxacin terrified me. I read about permanent damage caused by fluoroquinolines. I read about the drug causing mitochondrial damage, likely oxidative stress, and this might be correlated with patients who do not metabolize the fluoroquinoline scaffold as well as the general population. This, then, could easily explain how the drug is able to build up intracellularly, and since mitochondrial DNA are always dealing with the effects of their metabolic role, they are vulnerable to being overloaded. It's worth noting that mitochondrial DNA have bacteria-like ancestry, so they are certainly not guaranteed against large antibiotic concentrations. And of course, the longer the drug stays in your body before it finally finds a slow exit, the more time it has to cause damage. Indeed, bactericidal antibiotics in general have been associated with oxidative damage, and Big Pharma has been trying to solve this problem. I also read about warnings of spontaneous tendon ruptures, permanent tendinitis. July 2008 was the first black box warning by the FDA. Warnings of risks of mental health side effects and serious blood sugar disturbances causing hypoglycemic coma, risk of worsening symptoms for those with myasthenia gravis, all from fluoroquinolone antibiotics. The first black box warning came about after congressional hearings were held in regards to this drug. The warning was therefore hard-earned by people who were willing to voice their concerns. Reading about drugs can almost be like reading a boring dictionary. After a while, the textbooks are just words. When we make these situations personal and put stories behind them, they come to life and have meaning. In August 2013, the FDA required updates to the labeling to describe the potential for irreversible peripheral neuropathy, serious nerve damage. In 2016, the FDA enhanced warnings about the association of fluoroquinolones with disabling and potentially permanent side effects involving tendons, muscles, joints, nerves, and the central nervous system, and further said that for things like uncomplicated urinary tract infections and sinus infections, that the risk of serious side effects outweighed the benefits for patients and should be reserved for use in patients with serious, life-threatening infections or who have no alternative treatment options. These antibiotics are not only being used on humans, but veterinarians are also using them on our beloved pets, and farmers are also using them on farm animals that become our food source. Fluoroquinoline antibiotics are available as oral pills, IV varieties, and even drops made for eyes and ears. These should never be given to children or the elderly 60 above. Yet they are. The most recent black box warning was issued in April of 2019, stating that these drugs can increase the risk of rupture or dissection of aortic aneurysms. The pathophysiology of aortic aneurysms and dissection could be influenced by fluoroquinolones because the aorta's integrity depends heavily on an intact extracellular matrix. Fluoroquinolones induce degradation of collagen and other structural components of the extracellular matrix. Seeing as fluoroquinoline toxicity is a syndrome and has a constellation of symptoms, it's likely that there is a failure cascade that occurs post-exposure to fluoroquinolones. It's possible that this failure cascade is triggered by gut biome destruction, mitochondrial depletion, fluorine overload, depletion of cellular magnesium and iron, or another mechanism. Frankly, no one knows for sure the exact mechanism for fluoroquinolones leading to multisystem chronic illness. It is not entirely understood because there isn't enough research. There are many plausible mechanisms for fluoroquinoline toxicity if you start taking a closer look. As for the gut microbiome, my own research has uncovered that it takes anywhere between 2 to 12 months for the gut to fully repopulate beneficial bacteria and the numbers needed for good health. And this is true of all antibiotics. However, some much needed strains may never return after using a fluoroquinolone classed antibiotic. Researchers at Stanford screened more than 900,000 genetic samples from the stool of healthy men and women who took the antibiotic ciprofloxacin. They found that most of the gut microbiome returned to normal after only 4 weeks, but that numbers of some bacteria still remain depressed even up to 12 months after. Another study demonstrated that even a short course of the antibiotic ciprofloxacin reduced the diversity of the intestinal microbiota, with significant effects on roughly 1/3 of the bacterial species that failed to recover after 6 months or more, suggesting that even a short course of this antibiotic may cause permanent changes to the community of friendly flora in the gut. One of these important strains of bacteria is called Oxalobacter formigens. This bacteria is an oxalate-degrading anaerobic bacterium that colonizes the large intestines of numerous vertebrates, including humans. The broad-spectrum quinolone antibiotics kills O. formigens and could be the reason that my body repeatedly develops kidney stones. We must discover a way to recolonize these important bacterial strains if we want to find any type of healing post-fluoroquinoline toxicity. Perhaps drastic measures will need to be taken by offering patients fecal transplants from healthy donors. Incidentally, I discussed with my specialist recently, whom I had been referred to for my kidney issues, about Oxalobacter formigens bacterium, and he replied, "That's just a theory. We don't really know if that's what is causing reoccurring kidney stones." I don't think he appreciated my self-taught education, as some doctors really do have God complexes and have no interest in a patient-doctor partnership. Besides, this was just another dismissal. Another denial that ciprofloxacin does the damage that it does. Sadly, Canadian doctors do not recognize long-term fluoroquinoline-associated disability, also known as FQAD, despite the many black box warnings issued by the FDA, which started in 2008, and the United States recognition of the disability on their side of the North American border. Health Canada warned doctors of rare cases of persistent or disabling side effects in January of 2017. And yet they are still being offered for uncomplicated urinary tract and sinus infections today. Recently, late in 2017, I was offered ciprofloxacin for a urinary tract infection, which I refused and requested another, but not before my doctor blasted me for reading about drug dangers on the internet rather than trusting her expertise. And this drug was even prescribed after I had told the intake nurse I have adverse drug reaction to this drug, I have an allergy to this drug, anaphylactic, and they still prescribed it. So here in Canada, there is no real help for those suffering from disabilities related to adverse drug reactions to this class of antibiotic. Patients are shuffled off to countless doctor's appointments, seeing many specialists for different body parts, and are often being misdiagnosed with things like fibromyalgia, MS, and lupus. Canada does not have a good history in safeguarding the public from dangerous prescription drugs. I don't want to say that. I want to believe that we have one of the best healthcare systems in the world. But to me, what I've witnessed, I don't think so. As once again, Health Canada is slow in heeding the stern warnings against this class of antibiotic, fluoroquinolones, much like they were when thalidomide was withdrawn after thousands of mothers gave birth to disabled babies. Canadian doctors began to receive samples of thalidomide in 1959, but sales did not begin until April of 1961 under the names Cavadon and Talamol. The licensee was the Merrill Company based in the United States, but by April 1961, there were already warnings about thalidomide and malformed babies, as well as nerve damage in adults. On November 27, 1961, the drug was withdrawn from the West German market. A few days later, it was also off the market in the UK and Australia. However, in Canada, the drug remained on the market until March of 1962 and was responsible for over 100 children born with severe defects. This was something that was in the news. So it wasn't exactly something that could be easily swept under the carpet. They knew that the call had gone out in other countries. They knew what was happening, and yet they kept it on the market. Why? My own grandfather died from a stroke that was caused by his using Voltaren gel. Voltaren, as with other NSAIDs, there may be an increased risk of serious or possibly fatal cardiovascular events, heart attack, or stroke with the use of Voltaren gel. And these can happen without warning. There were also warnings and precautions and also adverse reactions to Voltaren, yet it's still on the shelves being sold over the counter here in Canada. I had to sell it to people when I worked at a grocery store pharmacy combination, and I wanted to warn people about its use, but because of what happened with my grandfather, but it wouldn't have been appropriate to do so. I would have probably lost my job. If Health Canada says that it's safe to be sold to the public, who am I to disagree? But this just goes to show you how closely Canada pays attention to the dangers of prescription drugs, as fluoroquinolones received their first black box warning by the FDA back in July of 2008. How many people have to be disabled or killed by this class of antibiotic before Canada will take action? How much money is it costing Canada in medical costs to treat disabled patients affected by fluoroquinolones and other dangerous drugs? Countless doctor's appointments and surgeries, wheelchairs, medicines, and even disability checks for those who can no longer work. How much is Canada spending on these things? The European Medicines Agency, also known as the EMA, published the results of a safety review on the 15th of November 2018, which has led to a ruling that due to disabling and potentially permanent side effects, suspension or restrictions of quinolone and fluoroquinolone antibiotics are necessary, and that patients who have previously had serious side effects should avoid them. Yet my husband must advocate for me while in hospital, because despite telling them of my adverse drug reaction and also listing them as an allergy, they still insist on prescribing them, not heeding any warnings. So obviously the message isn't getting through. Why? I suspect it all comes down to greed over morality. We don't know why some people experience an immediate adverse drug reaction while others experience one weeks, months, or even years later after taking multiple prescriptions of the same antibiotic. Delayed reactions are hard to trace back to an antibiotic that many doctors believe should have left the body without causing injury. As a result of this attitude of impossibility, meaning that rare reactions must equal that doctors are so unlikely to ever see an adverse reaction that the odds must be nearly impossible, family and co-workers assume their loved one's illness must be all in their heads. They mistakenly accept the doctors, who are supposed to be the expert here, determination and diagnosis. No proof via testing can only mean that the patient's problem is stemming from a mental issue, such as anxiety or depression, or that the patient is a hypochondriac. After all, everyone wants proof, right? All we have is our voice. But for some reason, our voice is being lost in the wind. These patients feel like no one is listening to them, including their physicians. And the trouble is that no one is listening. This adds even more to their burden of suffering, often tearing up families and friendships, which make them even sicker. Now they are sick and depressed, but we can clearly see which came first. It is difficult to try to fight a synthetic or biotoxin illness, and even more difficult when no one believes you are sick. A quote made by a friend who is also suffering from fluoroquinoline toxicity that mirrors my own thoughts. I've come to hate the word rare, as in your reaction is rare, or those side effects are rare, or it's rare for someone to suffer an adverse effects from fluoroquinolones. It's such a dismissive thing to say, although we hear it all too often. As if it's okay for this to happen as long as it's rare. As if it's okay for a certain number of patients to be collateral damage as long as the devastation that they experience is rare. As if it's okay for there not to be any research or resources or justice or answers to questions because the problem is rare. As long as what you experience is labeled as rare, it doesn't matter your experiences, your pain, your health stops mattering. You become statistically insignificant. I am not merely a statistic on a chart. I am a human being and I deserve the respect to be listened to, and also deserve to have research, resources, help, both medically and financially, and certainly answers to my questions. We are sick and we are scared and we need medical assistance and recognition of long-term fluoroquinolone associated disability in Canada. However, I do not believe that reactions are rare, as I belong to an online support group that is over 11,000 strong. Here, thousands of people who have fallen ill after fluoroquinolone treatment gather to share experiences. Many of them describe a devastating and progressive condition encompassing symptoms ranging from psychiatric and sensory disturbances to problems with muscles, tendons, and nerves that continue after people have stopped taking the drugs. We call it being floxed, or we refer to ourselves as being Floxies. It comes from the last part of the drug, ciprofloxacin, levofloxacin. Also, I meet people in public every day that have similar symptoms as myself, that have simply not connected the dots and figured out that their mystery symptoms are a result of them taking a fluoroquinolone antibiotic. And when you do point it out, they shake their heads in disbelief. Why? Because antibiotics are so trusted by the public as the cure for every infection known to man, such a God-save invention, that they cannot believe an antibiotic could hurt them. Yet I personally know 4 elderly people who died directly after receiving this antibiotic in their IVs. Their organs just shut down. I also have many friends, with some in our support groups, that have sadly committed suicide. Many people affected have family and close friends that do not believe the true reason behind their illness, and many marriages have ended. I feel that this is a dangerous drug, and I, for one, would like to see it pulled from the market, as I think we can do better. I know that many Floxies would like to see fluoroquinolones restricted to hospital use only. But we cannot forget that in rural areas of Canada, where access to doctors is limited, or in places like Timmins, Ontario, where I live, and have doctor shortages, we have no choice but to make use of the hospital for non-emergency reasons. When I get sick, I have no choice but to head to the hospital, where I am seen by an ER doctor for things ranging from the flu to uncomplicated urinary tract infections, and where they have no access to my medical records. It is at the hospital that you are likely to come home with a fluoroquinolone antibiotic, despite restrictions, because the ERs main purpose is to see patients in real emergencies, and we're never meant to see patients with the flu or colds. A quick antibiotic is given just to clear out another cot or exam room to fit in the next patient in the overcrowded waiting rooms. But I understand that fluoroquinoline antibiotics are the only antibiotic that can treat an aggressive bacteria called Pseudomonas. Pseudomonas is a superbug that can cause fatal infections. Therefore, the FDA and Health Canada cannot remove it from the market under these circumstances. So, here is my best advice to keep the public safe. Number 1, do exactly what the FDA and Health Canada says. The FDA have put a black box warning on Cipro and all fluoroquinolones. Make sure that they are never being given to patients unless they have a life-threatening infection like Pseudomonas or anthrax. Make sure that they are only being used as a last resort. Make sure they are not being given to children, and that means not in eye or ear drops either. Make sure that they are never given to the elderly. Make sure that they are never given to anyone who is an Olympic athlete. Make sure that they are never given to any patients suspected of delayed detox pathways, people with IBDs, IBS, or renal reductions, or liver disease. Make sure that every doctor is notified and made aware of this information. Make sure that doctors know that reactions are not rare. They're just being recorded. Treat this poison epidemic seriously so that when patients go to their doctor with an adverse drug reaction, that they are not being dismissed. And lastly, perhaps every time a provider writes a prescription for a quinolone, they should be forced to also write on the prescription the type of infection being treated. Then the pharmacist could double check for any adverse reactions or allergies and make a determination between if the situation is complicated and serious versus simple and easily cured with a safer antibiotic. Then the prescription can be changed before a patient is hurt. This is how the system should operate in order to safeguard the public, but it doesn't. Right now, the drug is being given out like candy to healthy people who have uncomplicated infections, and it's undermining their health and ruining their lives. This needs to stop. To complicate matters, like many chronic conditions, my fluoroquinoline toxicity symptoms tend to ebb and flow in severity. Some days, weeks, and months go really well, and during others it's difficult to work, socialize, and function, confusing those who can't see why one day is good and another a challenge. It's been 6 years since I was poisoned by ciprofloxacin. Update, August 2019. Many of the early symptoms have disappeared for me. I no longer have panic attacks as my digestion is improving with much work on my part that involves a healthy diet and some key supplements and probiotics. I have musculoskeletal changes though. My walking gait has altered, but at least I'm able to walk again and without a cane. I still have left hip joint pain and a sciatica issue, but I'm able to have sex again, as I can find a comfortable position that doesn't have me screaming out in pain. Thankfully, we have a very good marriage. My husband is very supportive, and we are able to express love in many ways that do not cause me undue pain. I am delicate and fragile. I still have low energy levels. I still have occasional insomnia. I also have system-wide inflammation and ongoing digestive and bowel issues, IBS, and celiac. My most recent blood tests have confirmed that I have further reduced kidney function with high vitamin B12 levels. Just 3 years ago, I was anemic and needed to supplement with B12 and folate, and now my B12 levels are too high. My recent visit to a specialist on September the 9th, 2019, confirmed that my creatine levels, blood and urine, were a high 185 on August 10th, and then 2 weeks later had reduced to 94. He measured my GFR as stage 3A, but wants me to retest my creatine levels every 3 months. He does not want to see my creatine levels rise, although he will be okay with slight fluctuations. In the meantime, I'm to stay hydrated, drinking plenty of water at room temperature. Some of my pain is coming from low back pain, and I'm showing many more signs now of a magnesium deficiency. I have been doing some research and have plans to correct this deficiency. The specialist made sure that my kidneys were not swollen and that I was not retaining water in my ankles, all promising signs. I have 2 kidney stones in my left kidney and 1 in my right, plus scar tissue from repeated kidney infections and antibiotic use. Or it could be caused from endometriosis, which can spread outside the uterus to the nearby organs. However, now that I am menopausal, my endometriosis is in complete remission. He advises me not to take any prescription drugs so as not to overwork my kidneys. If I need a painkiller, I can use Tylenol, but only sparingly. My potassium is 4.5, which is normal, but he is checking my calcium levels as I am currently supplementing with vitamin D. He wants me to continue with my healthy whole foods diet and to keep inflammation at bay. Magnesium is the 4th most abundant mineral in the body. It is known to be a cofactor for more than 300 reactions catalyzed by enzymes, including those essential for energy release from food and conversion to cellular work through formation of adenosine trypsphate, or ATP, in mitochondria. Magnesium is also required for synthesis of DNA and RNA. Magnesium is especially important in all of our body's electrical and electrochemical activities, including muscle contractions, heart rhythm, nerve conduction, and brain cell activity. Magnesium was one of the very first supplements that I used after I was poisoned by ciprofloxacin. I was showing signs of magnesium deficiency, and so I started supplementing with magnesium bisglycinate. However, I wasn't absorbing it well and started to also use a topical version that bypassed my stomach and also Epsom salt baths. You see, you need stomach acids to convert magnesium from an insoluble to a soluble form, and the fluorine in my ciprofloxacin had reduced my stomach acids, as well as wiping out the numbers of both bad and beneficial bacteria in my gut. I had to figure out a way to increase stomach acids by using digestive bitters, which are essentially bitter-tasting herbs, in order to stimulate my stomach into producing more hydrochloric acid. Then I had to figure out, all on my own, while sick, that certain foods and drugs can block magnesium absorption. For example, cooking or storing food in aluminum foil lowers stomach acids. Drinking fluoridated drinking water lowers stomach acids. Taking any antibiotics lowers stomach acids. Other things like not soaking legumes. There's something in the legumes that blocks magnesium absorption. So there's all these things involved. It's not just a matter of taking a supplement and saying, oh, you're low in magnesium. Oh yeah, take the supplement. You know, eat foods that are high in magnesium with no guidance, no, you know, we need to know the whole story of why and how to properly raise those levels, because after taking ciprofloxacin and other fluoroquinolone antibiotics, magnesium is probably one of the most important minerals that Floxies need. So I must make more changes to my diet, raise stomach acids, and supplement with magnesium bisglycinate until my levels reach 2.4 to 2.52 range, or until I am no longer exhibiting signs of magnesium deficiency, which the ciprofloxacin caused. I have had to become my own expert in a field of natural health that became a necessity because I couldn't find a doctor to help me figure this out. Natural doctors are not covered by OHIP, so Canadians who cannot afford to pay for their services out of pocket are at the mercy of the medical system that treats the human body not as a whole entity and treats illnesses and diseases but does not practice illness or disease prevention. And a medical system that is in the business of prescribing medicines that help slow down disease but do not cure it. And a medical system that knows nothing about healthy eating and how a diet can change someone who has a disease. For example, a ketogenic diet that can change around a person who has diabetes type 2 or help them to reduce weight. Or dispense dangerous prescription drugs that ignore warnings by patients and even by governing authorities like the FDA. Why? Because there is no money to be gained by healthy people, only by sick people. Big Pharma is all powerful. They have the money and the power to continue to get exactly what they want. They are in the business to make money. And sometimes a doctor who tries to go against his medical training, tries to do research on his own, instead of embracing this new research, they discredit him. They make him out like he's a lunatic. So nobody goes to him, no one believes him. They just believe them because they want to make money. Now when I try to go for simple walks, I have to take my time. If I push myself for a brisk walk, I get muscle fatigue and my legs just refuse to continue to propel me along without severe pain. It's called shin splints or medial tibial stress syndrome. The cause is stress on your shin bone and the connective tissues that attach muscles to your bones. They get inflamed and painful due to my weak ankles, stiff hip joints, and weakened core muscles. I have to baby my feet and step lightly and carefully as my Achilles tendons sometimes swell and become sore, and I fear that I will develop a spontaneous tendon rupture that will end with me in a wheelchair. Recently, I had a medial collateral ligament injury. The MCL is a band of tissue on the inside of your knee. It connects your thigh bone to the bone of your lower leg. Only my injury was not the result of some physical activity such as a game of soccer or an exciting holiday of downhill skiing, but simply because I was walking. I live with the unknown now. I don't know what the future will hold in regards to my health. Will it improve or will it continue to decline? Will I still be alive in my 80s and 90s or will I be blind? Will I see the faces of my grandchildren? I wanted to share my story with you today in the hopes that you can understand how passionate I am about educating the public, doctors and government officials, of the very real dangers these fluoroquinolone drugs pose. Then maybe we can get these fluoroquinolone antibiotics restricted in Canada. I am begging that research be done to help those who have been adversely affected by fluoroquinolones. Because if I can do the research while I'm sick, certainly doctors can. I feel that doctors need to recognize the dangers of these drugs and stop prescribing them for uncomplicated infections or for infections that they haven't even bothered to check for. Then perhaps we can focus on finding a cure and helping those who have been adversely affected. Perhaps we can start by recognizing fluoroquinolone toxicity as a disability in Canada. And now that you have been educated, you have a responsibility to take action. You can no longer claim ignorance or turn a blind eye to the suffering of so many Canadians. We cannot force you to hear a message that you are not ready to receive, but we must never underestimate the power of our united voices. My heart aches for those who have been injured much worse than I was, friends in wheelchairs or in hospital care, or for those who have lost loved ones due to death or suicide, or for those who are living in the streets because they lost their homes, or going hungry because they cannot afford the basics of life, such as food, all because their disability isn't recognized. I thank you for your time in listening to me today.